Hi, I'm Dr. Sam Engel. I'm in the Global Clinical Development Group at Merck Research Laboratories, and the title of my presentation is The Efficacy and Safety of Efinopegdutide in Patients with Non-Alcoholic Fatty Liver Disease and Type 2 Diabetes, Results from an Active Comparative Controlled Study. For patients who have what had been referred to as NASH or non-alcoholic steatohepatitis, more recently, the nomenclature is changing to call it metabolic associated steatohepatitis or steatotic liver disease. There are currently no available therapies. And so, NASH or MASH, as some call it, is a leading cause of liver transplant and other, complications related to end-stage liver disease. So with no effective therapies available, there's clearly a very high unmet medical need for us to address this problem. Efinopegdutide is a dual agonist of the GLP-1 and glucagon receptors. We believe that dual agonism offers a particular benefit in terms of reducing liver fat, since we can leverage both the weight loss effects that are observed with GLP-1 based therapies, as well as the complementary effects of glucagon on weight loss, but also importantly, the direct effects of glucagon on hepatic fat metabolism. So the overall study included patients both with diabetes and without diabetes. This was an active comparative controlled study. We used efinopegdutide at a dose of 10 milligrams, reached with 3 titration steps, compared to semaglutide 1 milligram, also reached with 3 titration steps. At the time the study was designed, higher doses of semaglutide were not available. Patients titrated the drugs over the course of 8 weeks and then continued on therapy for a total of 24 weeks. Liver fat was measured both at baseline and at the 24-week time point using the MRI-PDFF technique, which is the gold standard for measuring liver fat in the population. So, as I mentioned, the overall population included patients both with diabetes and without diabetes. For the purpose of the presentation that we've presented at the EASD meeting, we've done a subgroup analysis looking at the efficacy and safety of both drugs in the study in the type 2 diabetes cohort, which represented about 30% of the population, and in the non-diabetes cohort. So overall, as we had previously reported, there was substantial reduction in liver fat with efinopegdutide, approximately a 73% relative reduction in liver fat compared to approximately 42% with semaglutide 1 milligram. In this study, this post hoc analysis, we also looked at the 2 subgroups, the diabetes and the non-diabetes subgroups. And the reductions in liver fat, were similar for both drugs in both the diabetes and the non-diabetes subgroups. Some minor differences, which, we described in the presentation. Importantly, we looked also not just at the relative reduction in liver fat, but we performed responder analyses, which assessed how many patients achieved certain thresholds of liver fat reduction. For example, a 30% reduction in liver fat is thought to be necessary for histologic benefit. We also looked at other thresholds of liver fat reduction, including what we would call super responders, those people who had at least 70% reduction in liver fat. And there we saw, very minimal differences between the diabetes and the non-diabetes subgroup. This is important because given that the dual agonist contains substantial glucagon activity, and because of the known effects of glucagon on impacting glucose metabolism, we needed to understand whether or not there would be any negative effects of glucagon agonism on liver fat metabolism in the diabetes subgroup. Well, I think the take-home messages for practice are really that when we think about new therapies for NASH, we need to also understand how they behave in specific patient subgroups. Obviously, for this presentation, we focused then on the diabetes subgroup. There are, potentially differences in other baseline characteristics. There are differences, for example, in different ethnic groups. in terms of the way that NASH evolves. For example, the Hispanic population has a higher prevalence of NASH, and also even given the same level of disease, they tend to carry more of a burden in terms of the complications. And so the take-home message from my point of view is, as we start to consider therapies for the broad category of patients, we also do need to focus in on specific subgroups that may or may not differ in their response to a given therapeutic. So for efinopegdutide, we have moved on to a phase 2b study, which is currently underway. This is a study which will look at histologic endpoints using a liver biopsy at baseline after 1 year of treatment. This is both a placebo and active controlled study. The active control is semaglutide 2.4 milligrams. We have 3 different doses of efinopegdutide and a placebo group. And we think this will be the next step in terms of understanding whether these substantial benefits in terms of liver fat reduction translate similarly into benefits on histology.